I'm Dr. Radheshyam Naik. I'm a medical oncologist and I work at HCG Cancer Centre and Sampraddha Cancer Care. Cancer therapy is very complex and there are several types of cancers and several types of treatments. But majority of the cancer therapies which were available until recently had lot of adverse events, and many of the elderly people with comorbidities and poor performance status couldn't tolerate them, because unless you tolerate the treatment, you will not be benefited from the treatment. One of the new advances which has taken place in the field of oncology is the advent of immunotherapy. Immunotherapies at present give injections which are given intravenously in an infusion, and these are the drugs which stimulate the immune system of the body. So cancer suppresses immunity and thereby it can grow, and this suppression of the immune system by the cancer is blocked by the drugs which we give, this immunotherapy which we give, which stimulates your body immunity, and this body immunity ultimately kills the cancer. Now, given as a solo agents, immunotherapy drugs don't work that well, though they are very effective in certain percentage of patients. But when we combine them with other drugs, like we combine immunotherapy drugs with chemotherapy for that matter, then the effectiveness of the combination is synergistic and many more patients get their cancer controlled, and some percentage of the patients can go for long-term survival, even sometimes cure also. They also can be combined with other drugs like hormone therapy, can combine with anti-angiogenic treatments. These are the drugs which block the blood flow to the tumor. So these are immunotherapy drugs are versatile drugs which are patient-friendly, which can be tolerated even by the elderly people with comorbidities. But the only drawback of these drugs is the cost of the drug and the fact that these have to be given indefinitely. There are some drugs which can be added along with the immunotherapy. We call them as adjuncts. There are drugs which they themselves have some immune effect, like I mentioned chemotherapy, but there are drugs like levomizole, there are drugs like interferon or interleukins, and in some patients this addition of the adjuncts improves the efficacy of chemotherapy, and more patients may respond with their cancer shrinking and their life prolonging.